Welcome back, everybody, to another deep dive. We are diving deep today into the renal system. So that's kidneys and urine. I'm looking at our source material here, and I think we've got some pretty intense study notes.
Yeah, it looks like somebody was maybe prepping for a nursing exam or something like that.
Yeah, lots of details here. But hey, that's what we're here for, right? To break it all down and make sure you walk away, our listeners walk away with a clear understanding of the most important points.
Exactly. Even if you're not a medical expert, by the end of this, you will be.
Okay, so first up is acute renal failure. Now, I'm picturing this like my kitchen sink suddenly getting clogged up, no water's going down. Is that a decent analogy?
That's actually a really good analogy. Acute renal failure is basically a sudden and rapid decline in kidney function. Just like that clogged sink, your kidneys can't filter waste products from the blood effectively, and it can really throw off the body's balance and become pretty serious very quickly.
Okay, yeah. That definitely sounds like something you wouldn't want to ignore. The notes break down acute renal failure into three main types: pre-renal, intrarenal, and post-renal. I'm sensing a theme here.
Yes, definitely a theme.
Some kind of plumbing issue.
It's helpful to visualize it that way. So prerenal failure is like a kink in the hose that supplies blood to the kidneys. Something is restricting that blood flow to the kidneys.
Okay, so it's not the kidney itself that's the problem. It's something happening before the kidney.
Exactly. And then we have intrarenal failure, where the issue lies within the kidney itself. Think of it as damage to the tiny filters inside your kidneys. Millions of them. They're called nephrons. And those are working day and night to clean your blood. And things like certain medications, dyes they use for imaging, or even some infections, those can damage the nephrons and lead to intrarenal failure.
Gotcha.
All right.
So that's intrarenal. And then lastly, we've got postrenal. So is that the blockage kind of downstream from the kidney?
You got it. Postrenal failure happens when something is obstructing the flow of urine after it leaves the kidney. So this could be a kidney stone, a tumor, an enlarged prostate, all sorts of things. And what happens is the urine backs up, it puts pressure on the kidneys, and then it impairs their function.
I see. So it sounds like identifying which type of acute renal failure is happening would be crucial for figuring out how to treat it.
Absolutely. You wouldn't try to unclog your sink by fixing a leaky pipe that's leading to it, would you? Same principle applies here. The treatment depends entirely on what the underlying cause is.
Makes sense.
Okay.
This is making so much more sense. Now, the notes also mention something called the three phases of intrarenal failure. Can you walk us through those?
Sure. Imagine your body facing this sudden kidney shutdown. It's going to go through a series of stages as it tries to cope. First, there's the oliguric phase. And what happens here is your kidneys are trying to conserve fluid, so you end up with very low urine output.
Oh, so it's not just that the kidneys are failing, but the body is actively trying to hold on to the fluid.
Exactly. It's a survival mechanism. But unfortunately, this low urine output can lead to a buildup of waste products in the blood, and then you can have dangerous electrolyte imbalances. Your potassium levels can shoot up, while sodium and calcium can plummet.
That sounds not good. Is there anything that can be done at this stage?
Well, early intervention is key. So addressing whatever that underlying cause is, whether it's restoring blood flow, removing obstruction, stopping a medication that might be damaging to the kidneys, if we do that, we can help those kidneys recover.
So it's kind of like catching the problem early on and giving those kidneys a chance to bounce back.
Exactly. Then as the kidneys start to recover, you often see the diuretic phase. And now the kidneys are trying to play catch up. They're flushing out all those accumulated wastes and fluids. So you might see a big increase in urine output. It could be up to like 6 liters a day.
Wow. Okay, so that's not necessarily a good sign. It just means the body's trying to rebalance.
Exactly. And then finally, with proper care and management, those kidneys can gradually recover during the recovery phase. And this can take anywhere from a few weeks to a few months.
Okay, so it sounds like early intervention is really the name of the game with acute renal failure. But what happens when that damage is more gradual, more like a slow leak instead of a burst pipe?
Yeah.
That's where chronic renal failure comes in, right?
You're exactly right. Think of it like a car engine slowly losing horsepower over time. That's essentially what happens in chronic renal failure. It's a gradual, irreversible loss of kidney function over time. And it progresses in stages as those little filters, the nephrons, gradually wear out.
So unlike acute renal failure, which kind of comes on suddenly, this is more of a long game.
Yes, and unfortunately, there's no quick fix for this one. But understanding the stages can help us manage it and maybe slow down the progression.
Okay. The notes mention something called reduced renal reserve. What does that mean?
Imagine your kidneys having this reserve tank of filtering power. In this stage, you've lost about 40% of your nephrons, those little filters. Your kidneys are working harder, but they can still compensate, so you might not even notice any symptoms.
Oh, wow. So it's kind of sneaky, silently chipping away at kidney function.
Exactly. And then as more nephrons fail, you enter renal insufficiency. Now, you've lost about 75% of those filters, so the kidneys are really struggling to keep up. You'll start to see more noticeable symptoms like fatigue, changes in urination, even swelling in your legs and feet.
So it's like the warning lights are starting to flash.
Exactly. And then finally, we reach the most severe stage, which is end-stage renal disease. At this point, you've lost over 90% of those nephrons, and the kidneys can no longer keep up with the demands of filtering your blood.
That's incredibly serious. What are the main culprits behind chronic renal failure?
Well, the usual suspects are diabetes, high blood pressure, something called glomerulonephritis, which is inflammation of those tiny filters in the kidneys. And then there's polycystic kidney disease, which is a genetic disorder where cysts grow in the kidneys and disrupt their function.
This is definitely some heavy stuff. What are some of the symptoms that someone should look out for? Some red flags that might indicate chronic renal failure.
Well, changes in urination are a big one. You might find yourself urinating less often, or your urine might be foamy or bloody. You could also experience fatigue, swelling, particularly in your legs and ankles, high blood pressure that's difficult to control. Maybe you're having a metallic taste in your mouth, or even a strange symptom called uremic frost, where waste products build up on your skin.
Okay, so that's definitely something I would not want to miss. So at this point, with end-stage renal disease, what are the treatment options?
Sadly, at this stage, the kidneys are beyond repair. So the main options are dialysis, which is essentially an artificial kidney that filters your blood for you. And then there's kidney transplantation.
So dialysis is like taking over the job of the failing kidneys.
Exactly. It's a life-saving treatment. And then kidney transplantation, well, that's like getting a brand new engine for your car.
Right, that makes sense.
Mhm.
So let's talk a bit more about kidney transplantation. Finding a compatible donor seems crucial, right?
Absolutely. It's like finding a matching puzzle piece. So matching blood types and tissue types between the donor and recipient is vital to minimize the risk of rejection.
And rejection, what does that mean exactly?
Imagine your body sees this new kidney as a foreign invader, so it tries to attack and destroy it. That's rejection. And to prevent that, transplant recipients have to take immunosuppressant medications basically for the rest of their lives, and these medications suppress the immune system, making it less likely to attack that transplanted kidney.
So it's like calming down the body's defenses.
Exactly. But it's a delicate balancing act because while these medications are protecting the new kidney, they're also making the recipient more susceptible to infections. It's a trade-off, but it allows people with end-stage renal disease to live longer and healthier lives.
Are there any warning signs of rejection that people should be aware of?
Definitely. Fever, flu-like symptoms, tenderness over the area of the transplanted kidney, decrease in urine output. Those are all red flags. If you notice any of these after a transplant, it's crucial to contact your doctor immediately.
So it's about being vigilant and knowing what to look out for.
Exactly. Early detection and treatment are key to preventing serious complications.
Now let's shift gears a bit and talk about something that affects all of us, not just people with kidney disease. Aging.
Hmm.
As we get older, our kidneys, just like many other organs, don't function quite as efficiently. It's like everything starts to slow down.
Yeah, it's a natural part of the aging process. Just like a car engine wears down over time, our kidneys gradually lose some of their filtering capacity as we age.
Okay, so the notes mention something called decreased renal clearance of drugs. What does that mean?
Okay, so imagine your kidneys are like this waste disposal system, efficiently removing medications from your body. As we age, that system becomes a little bit sluggish, so medications tend to stay in our systems longer, which means they can potentially build up and cause side effects.
So it's like the garbage isn't getting taken out quite as quickly.
Exactly. So it's essential for older adults, especially those taking multiple medications, to be aware of this, and sometimes dosages need to be adjusted to avoid any potential problems.
Makes sense. Are there any other age-related changes in the urinary system we should be aware of?
Well, one that impacts a lot of people is decreased bladder capacity. So this simply means your bladder can't hold as much urine as it used to, so you might be making more frequent trips to the bathroom, especially at night.
Ah, so that explains those nighttime bathroom breaks.
Gotcha. What else? Another common change is weakened bladder muscles, which can make it harder to fully empty the bladder, and that increases the risk of urinary tract infections.
Okay, good to know. We'll come back to these age-related changes in just a bit, but first, the notes highlighted a specific type of medication that seems particularly important in the context of kidney function: diuretics.
Diuretics, often called water pills. They basically help the body get rid of excess fluid, so they're commonly used to treat conditions like high blood pressure and heart failure, but they can also be prescribed for kidney problems.
So it's kind of like giving the kidneys a helping hand.
You could say that, but because diuretics increase urine output, it's crucial to monitor fluid intake and output carefully, especially in older adults or those with kidney issues, just to prevent dehydration.
Right. It's all about finding that balance. The notes specifically mentioned furosemide. Why is that?
Furosemide is a very powerful diuretic. It's like a high-pressure hose, really effective at flushing out excess fluid. But that same power means it needs to be used carefully, especially in people with kidney problems, to avoid causing further damage.
This is a double-edged sword, in a way.
In a sense, yes. It's a valuable tool, but it needs to be used judiciously. So understanding how it works and being aware of the potential side effects, that's crucial. We'll actually delve a little bit deeper into the nursing implications and patient education points for furosemide in the next part of our deep dive.
Sounds good. That will be helpful for those in the healthcare field, especially those working directly with patients on these types of medications. But before we wrap up this first part, I do want to touch on one more topic that seems particularly relevant: urinalysis.
Ah, yes, urinalysis. It's a simple but powerful test that can tell us a lot about what's going on in the body, especially with the kidneys.
So it's more than just checking for a urinary tract infection.
Oh, much more. Think of it like a window into your internal workings. A urinalysis examines the physical and chemical properties of your urine. We're looking for clues about your overall health, including how well your kidneys are functioning.
So what exactly does a urinalysis look for?
Well, first we look at the appearance of your urine. Is it clear or cloudy? What color is it? Then we check for things like protein, blood, sugar, bacteria, which shouldn't be present in normal urine. And then we measure things like pH, specific gravity, which tells us how concentrated your urine is.
It's amazing how much information you can get from a simple urine sample.
It truly is. And it's a relatively quick and painless test.
Okay, so I think we've covered a lot of ground in this first part of our deep dive. We explored different types of renal failure, touched on the impact of aging on the urinary system, and even learned about the importance of urinalysis.
It's been quite a journey so far, and we've only just scratched the surface.
Indeed. We'll be back in just a moment to dive deeper into some of these fascinating topics.
Stay tuned. And we are back, ready to continue our deep dive into the renal system.
Yeah, as we were talking about diuretics and those powerful effects, it really makes you think about, especially for healthcare professionals, how important it is to have a really solid understanding of these medications. So we were about to get into some of those nursing implications and patient teaching points, especially for a potent diuretic like furosemide.
Right.
Where should we start?
Well, let's imagine you're a nurse caring for a patient who's just been prescribed furosemide. What are some of the things that would be at the top of your mind?
Well, given that furosemide is basically flushing fluid out of the body, I'm thinking monitoring the patient's fluid balance is going to be huge, right? We talked about dehydration, making sure that they're not losing too much fluid too quickly.
Exactly. It's that fine line. You want to achieve that therapeutic effect, which is getting rid of the excess fluid, but you don't want to tip the scales too far and cause dehydration.
So keeping a close eye on their intake and output, not just how much they're drinking, but how much they're urinating too.
Absolutely. It's like balancing a checkbook. You need to track both the deposits and the withdrawals to make sure you're not in the red.
Exactly. And some of those warning signs we talked about earlier, that excessive thirst, if they're urinating more frequently than usual, headache, maybe even feeling a little dizzy or lightheaded, those are all red flags, right?
Exactly. And those are things we need to educate our patients about as well, right? We want to empower them to be active participants in their care.
So it's not just about administering the medication. It's also about making sure that patients know what to look out for so they can get help if they need it.
Yeah, you're getting it.
And of course, let's not forget those regular follow-up appointments, especially early on in the treatment.
Right, because everybody responds to medications differently, and dosages might need to be adjusted. It's not one size fits all.
Exactly. It's about personalized care. So this is making me think about that urinalysis that we were talking about earlier.
Yeah.
It seems like that would be a really valuable tool for monitoring kidney function in patients on diuretics, wouldn't it?
It absolutely would. Remember, urinalysis can tell us so much about what's going on inside the body. It can help us track those changes in kidney function, electrolyte balance, and even detect potential side effects of medications.
Okay, so let's refresh our memory on what a normal urinalysis should look like. We talked about color, odor, pH. What were some of those normal ranges again?
Right. So normal urine, it should be a pale yellow to amber color, almost like straw. Odor should be mild, not like super strong or foul smelling. And then pH, which measures acidity, should fall somewhere between 4.6 and 8.0.
And what about some of those substances that shouldn't be present in urine?
Right. Things like glucose, protein, blood, and bacteria, these are all signs that something might be off. So, for example, if you find glucose in the urine, it could be a sign of diabetes. Blood in the urine could indicate a urinary tract infection or maybe even a kidney stone.
It's like a detective game, piecing together the clues to figure out what's going on.
Exactly. And that's where the expertise of healthcare professionals comes in. We are trained to interpret these results, to connect the dots, and then develop that plan of care based on the individual patient's needs.
Okay, so going back to those age-related changes we talked about earlier,
Yep.
we mentioned decreased bladder capacity, weakened bladder muscles. But I'm curious, what actually happens inside the kidneys themselves as we age?
Well, it's not just about those tiny little filters, the nephrons becoming less efficient.
Mhm.
The blood vessels that supply the kidneys, they can also become narrower and less flexible. That reduces blood flow, and it affects how well the kidneys can do their job.
It's like the plumbing itself starts to age as well.
Exactly. And this can have a ripple effect throughout the body,
Mhm.
affecting everything from blood pressure regulation to the production of red blood cells.
Wow. It really highlights how interconnected everything is. The kidneys play such a vital role in maintaining overall health.
They do, and it underscores the importance of preventative care and healthy lifestyle choices, especially as we age.
So what are some things that people can do to support their kidney health, especially as those years start to add up?
Well, one of the simplest but most effective things is to stay hydrated. Remember those nephrons, those tiny filters working tirelessly inside your kidneys. They need a steady supply of fluids to do their job properly.
So make sure you're drinking enough water throughout the day.
Exactly. And be mindful of those beverages that can actually dehydrate you, like excessive caffeine or alcohol. They can actually put more stress on your kidneys.
Good point. What else?
Controlling blood pressure is crucial. High blood pressure puts a huge strain on the kidneys, and over time, it can cause significant damage.
So this is where healthy lifestyle choices like
Mhm.
regular exercise and a balanced diet come into play.
Absolutely. And speaking of diet, limiting salt intake can also help protect your kidneys. Excess sodium can lead to fluid retention and increased blood pressure, which both put extra stress on those hardworking filters.
So put down the salt shaker and reach for the herbs and spices instead.
Now you're talking. And while we're on the topic of things to avoid, smoking is another big no-no for kidney health.
Okay, so we've got hydration, blood pressure control, watching the salt intake, ditching the cigarettes. Any other pearls of wisdom before we move on?
Yes, and this one might seem obvious, but it's worth emphasizing. Don't overdo it on over-the-counter pain relievers like ibuprofen or naproxen. Taking them too frequently or in high doses can actually damage the kidneys over time.
So being mindful of even those seemingly harmless medications.
Precisely. And if you have any pre-existing kidney problems, it's always best to talk to your doctor before taking any new medications, even over-the-counter ones.
That's great advice. It's a reminder that knowledge is power when it comes to our health. Being informed and proactive can make a real difference.
Well said. And speaking of being proactive, regular checkups and screenings are essential, especially as we age. Catching potential problems early on can significantly improve outcomes.
Okay, so we've covered a lot of ground in this second part of our deep dive. We've delved into nursing implications of potent diuretics like furosemide, revisited the power of urinalysis in assessing kidney health, explored the impact of aging on the kidneys, and even touched on some practical tips for supporting kidney health. What a journey.
It has been quite an exploration, and we're not done yet. We still have some fascinating territory to cover in the final part of our deep dive.
I can't wait. We'll be back in just a moment to wrap things up and leave our listeners with some final thoughts.
And we are back for the final part of our renal system deep dive.
It's amazing how much we've unpacked from these study notes. I feel like I've learned more about my kidneys in the past hour than I have in my entire life.
It's true. We've covered a lot of ground, haven't we? From those acute plumbing emergencies to that slow burn of chronic kidney disease, and even just the subtle but significant changes that come with aging.
And don't forget about those nursing implications and patient teaching points for those powerful diuretics like furosemide. That's knowledge that could make a real difference in people's lives.
Absolutely. Informed healthcare providers and empowered patients working together, that's a recipe for good health outcomes.
As we were talking about all the things that can go wrong with the kidneys, it made me wonder what a healthy kidney actually looks like. Is there a way to visualize that?
That's a great question. Imagine a smooth, bean-shaped organ about the size of your fist, kind of tucked away on either side of your spine just below your rib cage. And each kidney is packed with millions of those tiny filters that we've been talking about, those nephrons, working tirelessly to cleanse your blood.
So it's like this sophisticated filtration system, constantly working behind the scenes to keep things running smoothly.
Exactly. And it's not just about removing waste products. The kidneys also play this crucial role in regulating blood pressure, maintaining electrolyte balance, and even stimulating the production of red blood cells.
It's like a multitasking marvel. And yet, most of us probably take our kidneys for granted until something goes wrong.
Sadly, that is often the case. But that's why this deep dive has been so valuable. It's about raising awareness, not just about kidney diseases, but about the importance of kidney health as well.
Exactly. It's like that saying, you don't know what you've got till it's gone. So
Yeah.
let's talk about what we can do to protect these kind of unsung heroes, these vital organs that work so hard for us.
Well, we've already touched on some key strategies: staying hydrated, controlling blood pressure, watching our salt intake, and avoiding smoking. But there's another aspect that's often overlooked, and that's being mindful of medications.
You mean besides those potent diuretics like furosemide that we already talked about?
Yes. Even common over-the-counter medications like ibuprofen or naproxen, if they're taken too frequently or in high doses, can damage the kidneys over time.
So it's about being aware of those potential interactions and not assuming that just because something is available over the counter that it's completely harmless.
Exactly. Always read those labels, follow the recommended dosage, and if you have any concerns, talk to your doctor or pharmacist.
That's great advice. It's a reminder that knowledge is power when it comes to our health. Being informed and proactive can make a real difference.
Well said. Speaking of being proactive, regular checkups and screenings are essential, especially as we age. Catching those potential problems early on can really improve outcomes.
Okay, so what should people be asking their doctors about?
Well, if you have any risk factors for kidney disease like diabetes, high blood pressure, or a family history of kidney problems, it's important to have those regular kidney function tests.
And what do those tests involve?
Usually simple blood and urine tests. They can detect early signs of kidney damage. Your doctor can also check your blood pressure, look for any physical signs of kidney problems like swelling in your legs or ankles.
So it's about being vigilant and not ignoring those subtle signs that something might be off.
Precisely. Early detection is key. The sooner you catch a problem, the better the chances of slowing its progression and preventing those serious complications.
This makes me think about all those things that we can do in our daily lives to support our kidneys. We've talked about drinking enough water, but what about other lifestyle choices?
Well, maintaining a healthy weight is crucial. Being overweight or obese puts extra stress on your kidneys, just like it does on other organs.
So those healthy lifestyle habits, regular exercise, balanced diet, maintaining a healthy weight, those all contribute to kidney health as well.
Absolutely. And there's growing evidence that a diet rich in fruits, vegetables, and whole grains can be particularly beneficial for those kidneys.
So load up on those colorful fruits and veggies.
Yes.
Anything else?
This might sound surprising, but getting enough sleep is also really important for kidney health. During sleep, your body repairs and regenerates tissues, including those in your kidneys.
So those 7 to 8 hours of shut-eye are doing more than just recharging our batteries. They're giving our kidneys a chance to rest and repair as well.
Exactly. It's all connected.
This has been an incredibly insightful deep dive. I feel like I have a whole new appreciation for these remarkable organs that work so hard to keep us healthy. But before we wrap things up, I want to circle back to something you mentioned earlier, empowered patients. What does that actually look like in the context of kidney health?
It means being informed, asking questions, and taking an active role in your healthcare. It means understanding your risk factors, knowing the signs and symptoms of kidney problems, and working with your doctor to develop a personalized plan to protect your kidney health.
So moving beyond simply being a passive recipient of care and becoming a true partner in the process.
Exactly. It's about taking ownership of your health.
Well said. I think that's a perfect note to end on. To our listeners, thank you for joining us on this fascinating exploration of the renal system. We hope you've learned some valuable things, maybe even had a few aha moments along the way.
And remember, that journey of learning never ends. Keep exploring, keep asking questions, and keep those kidneys happy and healthy.
Until next time, happy learning, everyone.